I have a bad sore throat. I don't know what to do. I don't want to go to hospital because I'm afraid. And can I get it treated at home? If you're thinking exactly that, this is the right video. Hello everyone, I'm Dr. Rabindra, consultant surgeon. Today I'm going to discuss about the sore throat and its management at home focused. If you're new here, don't forget to subscribe to my channel and hit the bell button to get notified every time I post a video. Throat is a muscular tube that connects the nose and the oral cavity to the windpipe and to the food pipe known as the esophagus. The main function of the throat is to conduct the air and the food particles. So when there is an inflammation or irritation to the throat, it causes soreness. That is the pain, scratchiness, or irritation at the back of your neck. The most common cause of the sore throat are the viral illnesses. They account around 80% of the total cause of the sore throat, and they do not require any antibiotic. The second most common cause is the bacterial infection, which requires antibiotic. The most common bacteria is the group A streptococcus. They are just nothing but a gram-positive cocci in chains. The third common cause is the allergy, that is allergy to pollens, dust, or pet danders. The fourth most common cause is the gastroesophageal reflux disease. It means that there is a reflux of the acid from the stomach into your throat that causes constant irritation at the back of your neck, and you feel like something is being stuck in the neck. Other causes are exposure to the chemicals, smoke or irritants, tumor of the neck, or trauma to the neck. This can all cause the sore throat. What can you have with sore throat? Along with the sore throat, you have a difficulty in swallowing, and when the voice box or the larynx is affected, you will feel like difficulty in talking. And when you open your mouth, there will be redness over the posterior part of the oral cavity and the enlarged tonsils. Even white patches may be seen in the tonsils, which is suggestive of the bacterial infections requiring antibiotic treatment. Along with the sore throat, you can also have the fever, runny nose, nasal congestion, sneezing, dry cough, hoarseness of voice, or loss of appetite. But when you have the things that I'm going to mention, you must consult a doctor. There are swollen glands in the neck, difficulty in breathing, severe difficulty in swallowing, persistent fever, and appearance of the rash along with the sore throat. The condition that produces a fever along with the sore throat is known as a scarlet fever, and you need to see a doctor on that part. The first and the foremost thing that you have to do when you have a sore throat at home is the warm salt water gargle. You have to know how to make this solution, how to do it, and how many times to do it. If you do it improperly, it has no effect at all. How to make warm salt water gargle? Add 1/4 to half teaspoonful of the salt to 8 ounces of water, that is 240 ml of water or 1 glass of water. Stir it properly so that all the salt gets dissolved. Why warm water is that it helps to soothe your throat, and it also helps the salt to dissolve properly. How to do the salt water gargle? You have to put the warm salt water solution in your mouth, tilt your head so that the solution goes back to your throat, and then you gargle it for a duration of at least 30 seconds to a duration of 1 minute. You have to do at least 2 times a day, and every time you do it, the 240 ml of water must be gargled. But be cautious. Do not be overzealous and add too much salt. This can dehydrate your mouth and sore throat and can aggravate the sore throat. Did you know what are the different benefits of the warm salt water gargle? The warm salt water gargle creates an osmosis effect. That means the concentration of the salt in the warm salt water gargle solution withdraws the fluid from the inflamed mouth cavity and the sore throat, because of which the inflammation decreases, the pain decreases, the throat gets soothed. The second effect is that it breaks up the thick mucus, because of which the bacteria, the fungi, the allergens that is stuck in the throat can get washed away and help to decrease the pain and the scratchiness that you have on the sore throat. The third thing is that it can also help to balance the acid pH and prevent the gingivitis. And there are different studies, my clinic study done in Japan, that found out that the warm salt water gargle can prevent up to 40% of upper respiratory tract infections. Isn't that amazing? So it's very easy, and do it properly. It is very beneficial. Number 2 is drink plenty of fluids. The fluids help to moisten the throat and prevent the dehydration. Try different broth, caffeine-free tea, or warm water with honey, or different soups. Avoid caffeine or alcohol, which can dehydrate you. You can also consider lozenges that help to soothe your throat, but do not give it to children as they can choke them. Number 3, if you're a smoker, this is the right time you leave it, because the cigarette smoke also irritates the throat mucosa and predisposes to the viral and bacterial infections. Besides this, you also avoid other chemical irritants, dust, and pollens. Number 4, rest. Rest your body and rest your voice, because rest is healing. You eat well, you rest well, and maintain the silence. That's it. If pain still persists, you can take the acetaminophen, also known as the paracetamol, or ibuprofen. If there are features of allergy like sneezing, cough, or there is scratchiness over the throat, you can take antihistaminics like the levocetirizine, cetirizine, or fexofenadines. But if you have a swollen glands, you have enlarged tonsils and there are white patches, you have difficulty in breathing or severe difficulty in swallowing, you should consult a doctor, because you will need antibiotics and you may need other further investigations to find out the other extent of the disease. I know this video will help you, and I'm trying my level best to answer to all the comments they have asked me in the comment section, because I know a lot of people are in stress. They have so much of different thinking about the COVID-19, the panic attack, the depression, the terror. I just want people to get rid of it. God bless you. Stay safe, stay healthy, and stay strong.